Hello guys! Hi! Oh, muntik pa mahulog yung phone ko. Hi guys! Welcome back to my channel. My name is Gail and today we will be talking about a certain topic that is included on your RCSI exam and on your adaptation. So, actually, wait lang. May sinasort out ako nung biglang lumabas yung nag-stop yung countdown. Pero ayan, hello sa inyo mga nandiyan sa baba ngayon. Will you please comment down below kung saan kayo nanonood galing para alam natin. Meron na tayong nanonood. Actually, nakikita ko yung numbers ng nanonood, guys. Pero hindi ko alam kung sino kayo. Kung sino man po kayo, magparamdam po kayo. Ayan. Uy, by the way, guys, bago ako magsimula, I would just like to congratulate those people who actually, actually, wait lang, who actually passed the RCSI exam or the aptitude test last weekend. So, yung result nila lumabas nung Monday. Ayan. Palakpakan po. Ayan. Sa lahat po ng nasa baba, pwede po tayong magpalakpakan. Ayan. Guys, hindi ko memorize yung names nila, pero as I can remember, ayan, si Eileen, ayan, si Marvin, hi, hello, ayan, nandiyan ka sa baba. Marvin, di ba nag-click ka? Ayan, si Harold Palomado, ayan. Sila yung mga dating nanonood, so wala na sila dito, guys. Yun lang, heads up, wala na sila ngayon dito sa baba kasi tapos na sila. Meron na silang license. Ayan. Hi to Maeve Mave or Maeve the Explorer. Hi, good vibes tayo dyan. Ayan. So, i-mention ko lang yung mga names na nung mga nag-take ng aptitude test. Kasi I'm very happy sa result kasi they didn't expect it actually. Ayan, sabi ni Marvin Messina, muntik na bumagsak. Talaga ba? Talaga ba, ha? Hindi. Muntikan lang yon, Marvin. Minsan kasi nagda-doubt tayo, pero alam nyo yon. Alam natin na kaya naman natin. Ayan. So, shout out and congratulations sa mga pumasa nung nakaraang RCSI exam. So, si Eileen Quabo, si Irene Dormile, ayan sila yung mga nanonood sila noon. Um, si Harold Palomado, si Nice, si Ninya from Black Rock Clinic. So ayan, sila yung mga nag-pick. And eto nga si Marvin Messina. Yuhuu! Congratulations, Marvin! Ayan, si Marvin isa siya sa mga nanonood before. Di ba, Marvin? Ayan. And nakikita ko na yung post niya dito sa Facebook and he's enjoying Ireland. Assuming ako na nag-enjoy siya sa Ireland. Pero ayun na nga, guys. Ayan, you've asked for it. 'Di ba? Hinanap niyo siya sa akin. Ang daming nagko-comment, daming nagpi-PM. Ma'am Gail, Miss Gail, Trevor Lou, pwede bang kailan po ulit yung live stream niyo ni Miss ganito? Ayan. In demand ang beauty nito. So kaya ngayon, actually nakikita ko na siya. Ang pretty niya. At saka shout out pala sa mga armies kasi isa siya sa mga armies. Hindi yung mga army na mga soldier boys, hindi. Ibang army yung sinasabi ko, guys. Okay. Ayan, sabi ni Marvin Messina, Maka-ate Gil. Marvin, ilang taon ka? Maka-ate ka naman. Ayan, si Mads Manikat, nandyan sa baba. Hi, Mads. Ayan. Actually, hindi ko memorize ko sino yung mga nanonood before. Pero, once they comment, alam ko kung sino sila. Alam ko from which group sila. Ito si Mads, galing to siya ng the core group ng My NMBI. Di ba, Mads? Ayan. Tapos ito si Marvin. Isa siya sa mga nabudol ko po noon. At patuloy pa rin pong nagpapabudol sa akin dahil nanonood pa rin siya ng live stream. Marvin, nakapasa ka na. Kami lang to ni Golda. Okay na. Pero ayan, guys, dahil hinanap niyo siya sa akin, guys, let's all welcome. Ayan, may paganon talaga ako parate, di ba? Sasayaw ba siya? Dati kasi nagde-demand sila nasasayaw siya. Gusto niyo bang sumayaw? Baka mamaya i-PM niya ako, ayoko na mag-guest live stream mo kasi pinasasayaw mo ako. Pero ayan guys, let's all welcome on the stream, on our live stream here at RGN Preparation, Miss Golda Stephanie Tilanduca. O di ba may pasayaw, guys? Gusto niyo yon? Gusto niyo yung may pasayaw? Pero
Hello
ayan,
everyone! Hello everybody! Sa
ayan
mga subscribers ni Nurse Scale, kamusta kayong lahat? Masyado bang
masyado
kayo?
ka bang Jungkook fan? Halata bang Jungkook fan ka? Hindi. Maliit na
Masyado
bagay,
tayong
Miss Gold.
hindi ako nakapag-prepare, pasensya na, ambush interview. Joke!
Oo, hindi siya nakapag-prepare pero meron siyang hair clip.
Pero
Pakita mo
meron
naman
akong
yung
clip.
mo. Ayan,
Okay.
Jungkook na Jungkook, di ba guys? Ayan.
Okay na ako.
Okay ka na. Comment down below sa mga armies. Ayan.
Okay na ako. Ayan. Sige. Kamusta kayong lahat?
Pero kasi guys, eto lang, konting introduction lang kay Miss Golda. Sa mga hindi pa nakakilala kay Miss Golda.
Introduction talaga? Let's get straight to business, joke.
Straight to business. Hindi. Sa mga hindi nakakilala kay Miss Golda, ayan. Si Miss Golda, she's one of our administrator. Parang pangit yung administrator. Isa siya sa admin ng Filipino Nurses in Ireland. And if you're one of our members doon sa Filipino Nurses in Ireland, alam niyo na active si Miss Golda sa mga, alam niyo yan, sa mga pa-comment sa mga answers, sa mga answering sa mga pag-answer ng mga questions niyo. Pero ayan, siya sa mga admin at saka alam ko na dedicated talaga yan siya sa kanyang ginagawa and masaya siya sa ginagawa niya. Anyway, ayan, si Miss Golda, anong tawag nito? Galing na siya before, nag-RGN prep na kami. Nagkaroon na kami ng 2 episodes. Pero ngayon, of course, in demand.
Ibang makuha si Gail na na mag-guest. So, pasensya na.
Hindi yan totoo, guys. Ang dami kong speaker. Kaso nga lang, alam niyo yun, kasi nga spring pa summer na, summer na, andyan na yung araw. Hindi na kami magkasabayan man kami ng off, pero magkasabayan din po kaming gumagala. Ayan, kasi nag-ease na ang lockdown dito.
Hindi kasama dyan.
Ayan, pero ayan, sabi ni Donna Faye Bernabe. Present po, ma'am. Ayan, si Donna. Isa din yan siya sa mga bagong nag-subscribe sa atin. Hi, Donna. Ayan. So, Miss Golda, actually, matagal na natin tong pinlano. And muntik ko pang makalimutan. Ayan na. Muntik ko. Kung hindi mo ako tinanong, sabi ko, shucks, oo nga, may live stream kami. But anyways, ayan. Let's go to business na.
We'll hope to make the most out of your time, guys. So sa mga nanonood natin, mga subscribers Gail, sa mga nagpe-prepare for the RCSI exam. So hopefully, this small talk about the topic that we have today will enlighten you a little bit. Kahit hindi siguro natin ma-discuss lahat, but at least it will give you a little bit of information about the topic that we're going to discuss today. Ayan.
Kasi nga Miss Golda, yung iba, wala talagang idea like what is this topic all about? Kasi nga 'di ba, we all know the microorganisms and whatnot. Pero as I've told you even before sa mga live streams natin, they have their own terms here. Na English naman siya, pero bakit hindi ko maintindihan? Ayan. So, si Miss Golda, i-discuss niyo yung topic ngayon. And if you have questions, pwede niyo i-comment down below tapos i-entertain natin mamaya. Okay ba yun, guys? Kasi mukhang ready na talaga to si si Miss Golda.
Actually, may konting story, guys. Nakalimutan ni Gail na may live stream kami.
Actually, nakalimutan ko talaga. Tapos nung tinanong niya, sabi niya, tuloy ba tayo bukas? Sabi ko, shucks, oo nga pala. Wala kasi siya sa main calendar ko. Kasi yung main calendar ko nasa may bathroom ko. So, hindi siya nakasulat dun. So, wala. Nung chinek ko dito sa phone ko, sabi ko, shucks, oo nga pala. May live stream nga pala kami ni Golda. So, ayun.
Pero huwag kayong mag-alala, guys. Kasi ako din, nagka-cramming din kami. Sabi ko, ano nga ba pag-uusapan natin yun?
Pero, Golds, you're born ready. Char! Ayan. Alam mo na to, you're eating this for breakfast. Parang sagwa.
I'm eating this for breakfast.
Oo.
At work, ganon.
Parang dugyot. But anyways, ayan guys, without further ado, itatakal na natin. Magsa-start na sa Miss Golda. Para naman hindi kayo dyan nakatunganga at nakatingin lang sa itsura namin. Ayan.
Okay,
Okay,
so
Miss Golda, the floor is yours. Ayan.
so we'll make this as interactive and as lively as possible. So this discussion will be talking about the superbugs. Okay lang ba yung audio ko, Gail? Okay lang? Or nag-echo ako?
Hindi ka nag-echo pero medyo mahina or tenga ko ang mahina. Hindi ko sure. Guys, comment down below kung malakas yung boses ni Miss Golda or
Eto,
kung may
okay na
problema
siya?
sa audio.
Or
Ayan.
naririnig niyo ba?
Ayan, mas
Much better.
malakas pag malapit ka. Or I don't know, saan mo yung mic? Pero nasa ears mo, di ba?
Okay ba?
Yan.
Okay lang. Sige. Okay. Teka lang, meron pang isang mode eh. Eto, mas okay ba to? Sorry. Eto, mas okay siya. Mas clear. Or walang
yan.
change.
Hindi, yan. Medyo parang iba, medyo mas buo yan.
Sige. So, ito na lang. Okay, guys. So, as what I've said earlier, we will be talking about superbugs. So, ano ba tong superbugs na to? Dito siya si Superman. Ang corny ng joke.
Last na yan, Miss Golda.
Band na talaga ako dito.
Masisira na talaga ang image natin.
Okay, so ano ba itong superbugs na to? So, these are the infections, or sige, let's get straight to the point. Ito yung mga bacteria na parati nating na-encounter sa hospital, sa day-to-day nursing career natin. Ito yung punot dulo ng bakit tayo nag-hand washing, di ba? Bakit nga ba? Sige, bigyan natin ito ng definition, di
Bakit
ba?
nga ba, Miss Golda? Ayan.
So, di ba, if you will look at the RCS, pwede ba ako mag-screen share?
Oo, sige. Iaalaw ko. Sige, ilagay mo tapos iaalaw ko. Ayan.
Sige. Okay. So, sige. I-discuss natin kasi para at least sabihin naman nila na merong basis tong pinag-uusapan natin, di ba? So, we're not just talking about whatever. But we are sharing.
Actually kung gusto niyo, pwede niyo namang basahin. Pero alam mo 'yon, it's more interactive. Feeling ko mas maaalala niyo pag alam mo 'yon. I don't know, we are different from each other as how we learn. Yung iba minsan gusto nila yung naririnig nila, minsan yung binabasa, minsan nakikita. So ayan. Ito medyo lang. Medyo mas
So lang to, parang alam mo yun guys, para tayo nag-group study lang tayo, di ba?
Oo, ayan. Dapat pala yung DRG and Prep ang title, group study.
Dapat group
Superbugs.
study lang to. Kasi alam mo yun, parang alam mo yun, nasa Pilipinas lang tayo, nag-group study. May group study kami, char. Tapos may dala-dala. Secret.
Group study nga ba?
Alam niyo yan, guys. So anyway, so going back to the point, so as what I've said earlier, so we'll be talking about these superbugs. Ano ba itong mga superbugs na to? And it says here, so I got this from the official hsp.ie website. And you can also find this link from the RCSI overseas. So ito, papakita ko sa inyo ha. So para sa mga hindi yung mga bagong viewers mo, Gail. So ito guys, I will never stop telling you this, na all the topics are found in the Overseas Aptitude Test section of your rcsi.com website. Ayan guys, so makikita niyo siya sa screen share ko ngayon, na these are all the links under your minimum background reading. So ito po yan lahat. Please have the time to read through these links and familiarize yourselves with all of these. Kasi importante siya, kailangan natin siya. So, it will save our lives. Tama ba? Tama ba, Gail? It will make a difference in our lives. Okay, so
parang ganun.
Ganyan. So, because this morning we'll be talking about superbugs, we will just focus on this topic. So, it says here, it is for patients, families, and healthcare workers. So, of course, guys, ano nga ba tong superbug na to? So, I know in the Philippines, or when we were still nursing students from, like, from before, when we were a little bit fresh and younger, charot. So, we've been taught na ano yung pinaka-first basic na tinuturo sa atin sa RLE natin nung college tayo, na pinaka-basic. Diba? That is your hand hygiene. So, hindi yan mawawala sa lahat ng nursing procedure, sa lahat-lahat ng bagay, and even now na meron tayong world pandemic na fini-face, so which is the COVID-19, mas lalo pa nating nabigyan ng importance yung hand hygiene. So hand hygiene basically deters the spread of microorganisms. So ito na nga ba sinasabi ko na itong mga superbugs na to, these are commonly caused by bacteria. Pero sabi dito, so what is a superbug? It says it is a bacteria or bug that is resistant to many of the commonly used antibiotics. So these infections are caused by superbugs and are harder to treat and tend to make you quite sick. So bakit ba? I'm sure pag minention natin tong mga common infections na to under the superbugs, for sure, marami tayong mga viewers na narinig na to in their whole nursing career or even in their nursing student life. So, what gives rise to these superbugs? Itong superbugs na to, dati kasi, like maybe thousands and millions of years ago, wala pa siya. But it just evolved into what it is now because of a lot of factors.
Dati wala pa siya. Tapos ngayon, pinakain nyo kasi ng ayun, lumaki.
Parang ano lang, parang dati wala ka pang boyfriend, ngayon meron na.
Talaga ba? Bakit ako hanggang ngayon wala?
Ewan ko lang, meron na ba? Just.
Yun lang, yun lang.
Alam mo, hindi ko na talaga maintindihan itong mga analogy natin, no? Parang feeling ko, corny na. Pasensya, guys. So ano ba itong superbugs na to? So as you can see in the screen share that I have here, so one of the most common superbugs that we have is the MRSA. So ano ba itong MRSA na to? Diba? So the letters SA stand for Staphylococcus aureus. So which is a common bacteria found in our skin. So yung skin natin, meron siyang normal flora na tinatawag natin. And yung normal flora ng skin natin, normally, kaya nga siya tinawag na normal flora, meron siyang mga microorganisms which is composed of bacteria, minsan may virus mga minsan, di ba? Kaya nga tayo nag-hand hygiene, nadadapuan tayo ng mga kung ano-anong foreign organisms in our skin at sumasali siya sa normal flora ng skin natin. So one of the most common bacteria that is found there is your Staphylococcus aureus. So I'm sure narinig na natin tong MRSA, di ba? So it is methicillin-resistant Staphylococcus aureus. So the methicillin is the antibiotic, and then because the bacteria have evolved, parang nakapag-adapt sila sa presence ng antibiotic na to para i-fight yung mga infections, naging resistant tuloy siya. So through the years, nagkaroon tayo ng antibiotic resistance. So kaya, it gave rise to what we call now as MRSA. Pero, ano ba? Kailangan ba nating, do we need to be worried or concerned with all these things? So of course, as nurses, our main goal is to always give patient safety, di ba? So parati nating ina-emphasize yung patient safety. So when you say patient safety, syempre, kasama ng patient safety is dapat safe ang pasyente mo, Char. Gulo. So dapat...
Last na. Please,
Last na yun. Kung sinabi mong patient safety, syempre, it's the state of your patient being away from any harm. So kapag merong presence ng infection or any sign and symptom na meron siyang bug or superbug or whatsoever, syempre, nilalagay mo yung pasyente mo sa isang situation na prone siya to harm or to any infection. So ayaw natin yun, di ba? So of course, so before we go to that to prevention of these superbugs, i-discuss muna natin siyang lahat. So that one is MRSA. Okay? So, treatable naman daw ang MRSA, di ba? I think it's treatable. So mamaya malalaman natin yan. Ayan. And then the next one is VRE. So ano ba tong VRE na to? Diyos ko, ang dami namang mga kung ano-anong kacharcharan. So VRE stands for vancomycin-resistant enterococcus. So, So, kanina, minention natin si Staphylococcus aureus, di ba? Parang char, parang tayong ano, parang kung sa Miss Universe ka, di ba? Naka-move on na bang lahat sa Miss Universe, guys?
Mukhang hindi pa. Mukhang may galit pa po. Mukhang may
Ako,
galit
naka-move
pa
on
po.
na ako.
Comment down below kung may galit
Oo,
pa po
naka-move
sa
on ako.
nailutong ulam ng
Oo, nag-move on na lang ako. Ganon. Pero bet ko talaga si Miss Peru from the national costume to the question
Di
and
ba
answer.
nga
Char!
sabi nga, di
Okay,
ba nga
sige.
sabi
Mamaya,
nila, si,
oo. Alam mo, tapusin natin ito pag pinag-uusapan natin sa Superbugs para mamaya marami pa tayong time for chikahan, di ba? So, VRE, going back. So, your vancomycin-resistant enterococcus. So, the enterococcus is a type of gut bug. So, sabi daw nasa gut. Ano ba tong gut natin? So, nasaan siya, guys? Ano ba tong gut? The gut is another term for your intestine, di ba? So, or basically our abdominal cavity, our, ano bang pwedeng tawag na ano? na body system sa kanya. So, enterococcus is harmless.
gastrointestinal tract. Oh.
Exactly. So, sabi dito, enterococcus is harmless in the gut, but can get into the blood of vulnerable people and cause a serious infection. So basically, guys, ito palang enterococcus, the same as your Staphylococcus aureus, it is very common and it could be harmless in the gut. But for those people that are vulnerable, so ito ha, kung pwede natin, if we can only underline or highlight this term, vulnerable people, sino ba itong mga vulnerable? Hindi ibig sabihin ng vulnerable ay yung taong kaka-break lang ha. So, us. So, vulnerable people are those that are immunocompromised. So, aside from the immunocompromised people, it could be our elderly or our pediatric. Tama ba? So, yun yung mga vulnerable kasi kailangan nila ng TLC, kailangan nila ng tender loving care, di ba? So, kaya, if a normal healthy person gets this kind of infection, siguro, may infect siya, pero it won't be as bad, it won't be as worse kung healthy ka, di ba? Whereas if you're infected, if your vulnerable population are infected by this, syempre, mas grabe yung side effects sa kanila because kasi nga, their immune systems are not as strong as a normal healthy individual. So some enterococcus are naturally resistant to a lot of ordinary antibiotics. So sabi dito, one of the example, itong VRE na pinag-uusapan natin is the vancomycin-resistant enterococcus. So we all know, guys, that vancomycin is a very common antibiotic in everywhere in the hospital. So parati natin siya naririnig. So your vancomycin comes in your intravenous formula or your oral formula. So marami siyang pinagagamitan. It's just so happen na itong bacteria na to ay resistant sa kanya. So babalik tayo doon sa mga antibiotic resistance na sinasabi natin. So sinabi ulit dito na the steps needed to stop the spread of VRE is very similar to the steps needed to stop the spread of CPE. So mamaya pupunta tayo kay CPE. Kasi katulad din nung nandun sa MRSA, sabi din doon, the steps needed to stop the spread of MRSA in the hospital is very similar to the steps needed to stop the spread of CPE. So, meaning, etong superbugs na to, magkakaiba man sila ng pangalan, magkakaiba man sila ng ini-infect na body system or body part, pare-pareho lang sila ng way of prevention, di ba? So, mamaya malalaman natin yan. Ito pa. Meron pang sinasabing ESBL. Sino ba tong ESBL na tong na gustong makisali sa group? So, ESBL is your extended spectrum beta-lactamase. Ang haba, no? Extended
Ayoko
spectrum.
na memorize eh. Pag ano, it's ESBL. What is
Yeah,
ESBL? ESBL. Pero guys, memorize nyo to ha. Memorize nyo yung ESBL.
Ay, magaling naman kayo mag-memorize. Memorize nyo nga yung number ng crush nyo nung high school eh. Okay. So, ano ba tong ESBL na to? So, ayan. This is a difficult, sabi talaga dito ni HSE, di ba? This is difficult term to explain, but briefly, the term is used to describe some common bugs that are not killed by some of the antibiotics, such as cefoxitim, and that we started to use a lot in the 1980s. So basically, guys, it's another bug that is resistant to the beta-lactams. So it is, kaya nga siya, ano yan, nakakalimutan ko palagi, extended spectrum beta-lactamase. So these are the bugs that are resistant to the beta-lactams, and one common example of this is your ampicillin antibiotic. Ayan. So, sige. Ang hirap ng mga terms na nandito, no?
O, diba? So, kung binasa nyo, guys, tapos nagdilim na yung paningin nyo, kasi hindi
Oo,
nyo
sige.
maintindihan, panoorin nyo pa ang live stream ni Miss Golda. Ayan.
Actually, hindi ko nga alam kung may matututunan sila sa pinagsasabi natin.
Uy, grabe
But I
ka.
hope,
Hindi,
guys,
syempre. Kung ako din naman, wala akong ka-idea-idea. Hindi, syempre,
Oo
meron
nga.
din ako
At
natutunan.
least,
Diba,
meron
guys?
kayong
Comment
idea
down
kung ano
below
siya.
kung may natutunan kayo. Bigla
So
ganun.
far, ayan. So, di ba? Kasi we're making the most out of our short time that we have. So, na-mention na natin sino yung number 1? MRSA. Na-mention na natin sino pa? Si VRE. Na-mention na natin si ESBL. Ayan. At meron pang sinasabing CPE. Sino ba tong CPE na to? Wala kasi siya dito si CPE. Nandito ba si CPE? Wala kasi siya dito sa ano na to. But what is
lang
CPE?
actually
So,
yung diniscuss nila.
CPE is actually a new thing kasi, di ba bago lang siya, Gail? I don't know ha. Sa hospital kasi namin,
Actually, hindi ko siya narinig. Ang alam ko, MRSA,
PRE.
MSSA. So guys, iba din yung MRSA sa MSSA. Tapos
Miss Gail.
VRE.
Ano yung ibig sabihin ng MSSA?
MSSA is methicillin sensitive Staphylococcus aureus. So sila yung mga patient na sila yung mga staff na sensitive naman sa methicillin. 'Di ba etong si MRSA resistant siya.
Basically, it is the
Basically,
opposite.
if you want to treat,
Yun yung opposite ng resistant. Tama ba? Kasi sensitive siya doon, di ba?
Sensitive, yeah.
Okay. So, adding up to our list of superbugs, kasi kanina pa mini-mention dito ni HSE si CPE. So, ano ba tong CPE, guys? So, CPE is your carbapenemase producing enterobacteriums.
Ang hirap, besh.
Kasi para before we discuss the prevention of these superbugs, ayan ha. Nakikita niyo naman, di ba? CPE.
Actually, pwede mo siya i-zoom in. Actually, zoom in ko yung sarili ko, di ba?
I-zoom in mo tong share ko. Huwag mo i-zoom in yung mga mukha natin. Ayan. So, nakikita naman, di ba? So, what is CPE? O yan, guys, ha? Nasa HSE na website tayo. Wala tayo sa kung saan-saang website. Ayan. Na-zoom in ba, Gail?
Hindi. Kailangan mo siya i-zoom in yourself.
Ako mag-zoom in. Sorry. Ayan.
Wait lang. Pwede ko din siyang palitan yung layout to this. Ayan.
Ayan.
Kita niyo na ba, guys, si CPE?
Ayan, di ba, guys? So, ito yung logo, ha? Ayan. HSE, Health Service Executive. Chos. Kasi, syempre, we have to...
Actually, Golds, yung nakikita namin, yung PDF file lang.
Ay, sorry. Yan ba? Pasensya naman. Kasi, isa-stop ko. Tapos, screen share ko ulit to.
O, di ba nakatingin ako dito? O, di ba, walang hiya!
Sorry
di ba
naman.
lang nagsabi na i-exit niya?
Ito na ulit. Ayan. Ayan na.
Ayan.
Okay. So, sabi na sa inyo, group study lang to. Ano ba kayo? Pero at least we're getting this from all our credible sources. Diba? So, ano itong CPE na to?
Credible sources. Ayan.
Chos. Ano ka ba? Dapat credible sources. Kasi syempre.
Oo naman.
Oo naman. Diba? Ayan. So, what is CPE? Kasi kanina pa siya mini-mention dun sa article na tinitingnan natin. Hindi naman natin alam kung ano itong CPE na to, diba? So, what is your CPE? It is the carbapenemase producing enterobacterials or bacteria. Basically, bacteria ulit siya. Bugs that live in the gut. O, yan ha. I-highlight ulit natin. CPE are a type of superbug. These are bugs that are resistant to many antibiotics, and this means that some antibiotics that were used to treat them no longer work very well. So, guys, the same as the other superbugs that we've mentioned, paano ba natin siya nakukuha? Bakit ba tayo nagkakaroon ng ganito aside from antibiotic resistance? So, paano natin siya nasa-spread? At bakit pa nagkakaroon ng mga outbreak nitong mga superbugs natin in the hospital? So, of course, guys, nursing is a very parang siyang contact, ang tawag dito, na it entails you to really be in contact with your patients, right?
Patient.
So, because of that, because of this superbugs that we have, our hospitals or our institutions have placed precautions or infection control precautions in each and every like hospital or institution para ma-prevent yung spread ng superbugs na ito or para ma-prevent yung outbreak ng superbugs na to. So of course, guys, so most of the time daw, sabi nila, CPE are harmless and don't cause infection if they stay in your gut and they won't make you sick. But it can cause serious infection if they get into your blood, kidneys, bladder, or body tissues. So, eto pala. Kaya pala, sabi dito, so di ba kanina, sinabi dun sa article na your MRSA, your VRE, and your ESBL has the same prevention of preventing CPE. Kaya pupunta tayo kay CPE kasi kung i-discuss natin siya, meaning kapag alam natin paano i-prevent yung CPE, we already know how to prevent the rest of the superbugs. Tama ba?
So prevention is the same with all of the superbugs. It's just that you have to know where it is located. Like say
Yun.
Staphylococcus is on the skin and
Yes. The
CPE
enterococcus.
Oo, nasa gut.
Yeah. Diba? So, yun na lang siguro yung take-home assignment nila, Gail, diba? So anyway, going back to the prevention, so preventing the spread of CPE, the best way to stop picking up and spreading CPE is to, first and foremost, talagang minensyon ko to kanina, clean your hands often. So, hand hygiene, guys, hindi mawawala. To deter the spread of microorganisms, do proper hand washing, hand hygiene. So, pag na-mention yung hand washing and hand hygiene, meron tayong tinatawag na 5 moments of
hand hygiene.
Di ba? So, papakita ba natin dito, Gail, para ano? Para at
Oo,
least
pwede
klaro
naman,
ulit.
pwede. Oo, sure. Guys, etong hand hygiene, we have an RGN prep for that one. But then, of course, as for the discussion today, papakita ni Golda sa inyo yung 5 moments of hand hygiene, which is palaging tinatanong ng infection control nurse pag nag-round siya.
Gusto ko hanapin yung HSE talaga na nandito.
Pero actually, pwede na, the ones that are online, yun din yun.
Yun din yun, di ba?
Oo. Guys,
Gusto ko
don't forget. Gusto niya na may picture. Guys, habang hinanap ni Golda, please don't forget to like this live stream, please. And share this one to your friends na nagre-review or papunta rito. Kasi guys, katulad nung sinabi ko, merong mga terms, English term siya, pero pag English naman siya, bakit hindi ko siya naintindihan? Yung parang ganon. Kasi they have their own terms here. Parang ganon. Yung parang, kumbaga pa, they would say that, katulad nga yan, superbugs, bacteria lang naman pala. Alam mo yung ganon? So, you have to know these little things naman. Ayan, habang hinahanap ni Golda, wait lang, basahin ko yung comment.
Ayan
Sabi ni
AJG. Sige, magbasa ko muna ng comment, pero I think I've already shared screen it.
Ayan, yan. Sige, ilagay ko na siya sa screen.
Sige,
sabi ni
shoutout ko muna ng
AJG,
mga comments so far.
sabi ni AJ, madami pong MRSA case dito sa KSA. Oo, actually AJ, pag pumunta ka dito, isa-swab ka ng MRSA. And guess what? Lahat po ng galing ng Saudi at KSA ay positive po sa MRSA.
Ayan. Okay. Sino pala?
Sa ospital namin, nagsaswab sila. Tapos, yung mga galing Pilipinas, nagpa-positive na. Nagkakaroon sila, sila. Ano yung test ng TB? Basta, yun sa kanila. Kung galing sa Philippines yung TB. Tapos yung sa...
Manto. Yung
Manto test.
Oo.
Pero parang nire-repeat nila, nagiging negative naman. I think, lang yun, parang precautionary measures nila kaya nila ginagawa. Tapos, yun na nga, yung mga galing Saudi, nagpa-positive talaga sa MRSA. Kaya you are right dyan sa sinabi mo, AJ. Ang dami talaga as in.
Oo.
Ayan.
So
Eto na,
guys,
ayan
actually,
na. Andito na.
syempre as
Ayan.
healthcare professionals, 'di ba? So, we know na we can be carriers of a lot of things, 'di ba? Bacteria, viruses, and that is the reason why we have to really pay attention to infection control, to proper hygiene, and to proper PPEs or personal protective equipment. So mamaya mention natin yung mga personal protective equipments. So, syempre guys, it's your own responsibility. Like, you know what? Aside from talking about Superbugs, aside from getting the RCSI exam, syempre, kailangan talaga natin pag-aralan. Ano ba itong mga to, di ba? I mean, because it's our own responsibility as nurses, as healthcare professionals, na malaman itong mga bagay na to regardless na magti-take ka ng exam or not. Kasi syempre, this is the core of nursing, di ba? So, para maging clean and green. Charot. So anyway, babalik na
Guys,
ako, Gail. Ayoko na
Oh,
nawawala
AJ,
ako.
nandito ka na ba sa Ireland, AJ? Ayan, comment down below kailan ang exam mo or kung nasan ka ngayon and your hospital. Ayan.
So, balik tayo, Gail. So, naka-screen share siya, diba? So, kasi parang hindi tayo mawala dun sa topic ng CP. So, your 5 moments of hand hygiene, eto siya. So, 5, diba? So, kaya nga siya 5. Hello. Number 1 is before touching a patient. O, diba, guys? So, before pa kayong pumasok or whatever, before pa kayong gumawa ng any kind of procedure or just before coming in contact with your patient, you have to wash your hands. So basically, in reality, bago kayo pumasok sa room ng pasyente, tama ba? Diba? So, nasa station tayo, hugas tayo ng kamay, ganyan, papasok tayo sa room ng patient. Number 2 is before a clean or aseptic procedure. So, of course, bago ka, ano ba ibig sabihin? Di ba, may nakasulat doon maybe before priming an IV fluid, or maybe before attaching your primed IV set to your hub. So, di ba? Any procedure that entails aseptic non-touch technique or any clean procedure, you have to wash your hands. Number 3 is after body fluid exposure risk. So, alam mo, napakaganda nitong illustration na to kasi meron siyang examples, di ba? Ayan, so sa number 3, makikita mo, after body fluid exposure risk. So, di ba makita mo dito, meron siyang indwelling urinary catheter or meron siyang catheter bag. So basically, kapag daw after mong na-expose dito sa fluid na to or after mo siyang in-empty, you have to wash your hands, of course. And then number 4 is after touching a patient. So di ba nakita niyo yung arrow na palabas ng patient? So that's number 4. And number 5 is after touching the patient's surrounding. So of course, pagkatapos mong umalis ng ospital or pagkatapos mong i-touch lahat ng surrounding ng pasyente mo, of course, you have to wash your hands. So, guys, kailangan po siyang i-memorize. Itong 5 moments of hand hygiene. Kasi po, kapag memorize natin siya, mataas ang point natin, Charm. Pag memorize niyo siya, mas ma-explain niyo ng mabuti paano yung how infection control works. Tama ba?
So, at saka pag memorize nyo siya, hindi kayo malalagot sa infection control nurse nyo.
Oo, kasi, I mean, di ba, ano naman siya like common sense, pero we use this in our day-to-day lives, not just in the hospital, but when we are in our homes. Syempre, naghugas tayo ng kamay, before tayo magluto, after nating magluto. So, di ba, after tayo maglinis, before tayo maglinis, di ba, so we wash our hands. So, hand hygiene is essential. Just. Ayan. So, babalik tayo dun sa ating pinag-usapan kanina. I-X ko na siya. So, stop ko muna siya. Okay. So far ba? Okay ba tayo, guys? Marami bang mga comments here? May mga questions ba?
Actually, sabi ni AJ dito, sabi niya, andito pa po sa KSA. Nagsa-start pa lang ng requirements na i-upload sa MyNMBA and wala pa pong schedule for OET. Sana soon na po, sabi niya. Sabi niya pa, strict po, strict din po infection control namin sa 5 moments. Actually, AJ, mas strict dyan. Kasi yung parang dyan kasi, yung mga infection control, based on my experience, infection control nurse, magtatanong sila. Tapos, meron pa silang mga, ang dami guys. Sa Saudi, marami silang mga chu-chu-chu-chu na minsan tatanungin ka ng case ng pasyente. Hindi lang infection control, pati yung mga clinical nurse, yung mga educators, tatanungin ka ng case ng pasyente mo, bakit ganyan ang management, bakit ganyan ang antibiotic ng patient mo.
Wow. Para ka na rin parang nag-RCSI exam dun sa KSA.
Oh, actually, kung alam mo meron kayong mga parang competencies, tapos bago ka makapasa sa competencies, ang daming mga questions, mga ipapa-perform ka,
Mala RCSI din pala, Gail.
Mala RCSI din.
So, kayang-kaya nyo pala yan, guys. Diyos ko naman. You can do it!
Ayan.
Kaya nyo. Ayan. O, sige.
Tapos may tanong siya, may IPSG din po ba? Sabi niya, parang International Patient Safety Guideline ba to? AJ, I forgot now. But meron siyang IPSG sa Saudi. Pero I don't think dito sa ina-acknowledge ng IPSG
iba kasi
as IPSG.
Iba yung standard ng Ireland sa Middle East. Kasi I think Middle East is parang medyo Americanized yata kayo, no?
It is American.
Yeah, you're more Americanized in terms of standards. So, parang katulad sa Pilipinas. So, even those coming from yung mga top-tier hospitals ng Philippines, like St. Luke's Hospital, yung mga
Manila Doctor.
Yeah, mga Makati Med, Asian Hospital.
Yan. The Medical City, mga ganun.
Kasi ako, galing po ako ng provincial hospital
Ay, ako din.
Sa probinsya. So, I mean, hindi naman natin ipagkakait yung experience natin from the provincial hospitals, from the provinces, because it's the same discipline. So, alam natin yan na, di ba? We can prioritize and we can handle patients.
Ayan, oh. Magkaiba lang po ng sahod, pero pareho lang po tayo ng mga
Yon. But anyway, sige, babalik tayo ngayon kay CP. So, screen share ko siya ulit, Gil. So, we will go back to the prevention of our CPE. Kasi nga, ayun yung nandun daw kasi yung pare-pareho lang daw sila ng pagpe-prevent. So, tapos na tayo kay clean your hands often, di ba? Tapos na hand hygiene. The next is to, of course, sabi dito, remember to clean your hands thoroughly after going to the toilet and before eating and before touching raw meat. So, syempre, guys, just ko naman, common sense na yan, guys, di ba? Kailangan nating maghugas ng kamay. Guys, especially, mga boys, after nyong umihi, maghugas kayo ng kamay, right? Use your own soap, flannel, sponge, and razor. So, grabe naman, may mga nagsishare ba ng dito, ng razor, tsaka ng dapat that's your own personal use, right? And if you're in
kahit
the
sa magjowa. Kahit sa magjowa, huwag kayo mag-share ng sponge.
Oo nga, wag din kayo mag-share ng toothbrush. Yan. If you're in the hospital, limit contact with patients and keep away from their bed space. So, tamang-tama. Alam mo itong write-up na to ng HSE. Ginawa to pre-pandemic time pa. Pero, it still applies to like pandemic period because social distancing, di ba? So, pag nag-uusap daw kayo ng pasyente mo, of course, there are times na kailangan talagang super duper close ka. But if you need to wear a personal protective equipment, so ito pala. So patients that are diagnosed or having history of these superbugs that we've mentioned, MRSA, VRE, CPE, ESBL, ano ang dapat natin gawin na personal protective equipment? So in our hospitals, we have what we call the contact precautions. So, ano ba tong contact precautions, Gail? Kasi I know you are with pediatric, ako I'm with adult. So, if you have a patient na merong ganitong mga superbugs, we usually wear a pair of gloves and our gown or apron. So, pag naka-contact, pag merong nasa door ng pasyente na nakasulat na contact precaution, usually nakasulat doon kung ano yung PPE na dapat mong gamitin. But the most basic personal protective equipment that you can use is your apron, your gloves, and your mask, especially now that it's pandemic period. So, mandatory na pong naka-face mask. So, if you are going to a patient with CPE, this is just in our hospital, sa hospital namin. Kapag CPE, hindi siya yung apron, but the full body gown with your gloves and your mask. So, iba-iba siya ng precaution. Kada institution, I think. But the most basic one is your apron and your gloves. So, avoid sharing food, newspaper, other personal items. Tell staff if facilities in a hospital or clinic are not clean. So, usually din sa hospitals natin, kapag na-discharge yung pasyente na merong history of the superbugs, any superbugs, usually meron tayong mga iba-ibang hospital protocols na sinusunod. So, minsan pa nga, I don't know, Gail, kung sa inyo, I don't know sa pediatric, Gail, but sa adult, when a patient is being discharged after having history of VRE, usually after deep cleaning, UV light pa nila yung room. Ganun din ba sa pediatric?
Sana all. hindi sila pa UV light, pero I know we have like merong kunwari say for example I think LRE ata. LRE yung patient.
May mga special kayo.
May special siya, pero pag kunwari say VRE lang or ganun, isolation discharge lang siya, cleaning. Pero pag I think LRE, it'll stay like parang 72 hours na hindi gagamitin yung room, tapos isa-swap siya.
Okay. So, yun yung sinasabi ko, guys, na I think different facilities, different hospitals, different institutions have different protocols of each. So, you just have to familiarize yourself. But,
in general, it is an isolation discharge. So, merong type of isolation discharge cleaning na ginagawa yung mga naglilinis.
Yan. So, actually, tama-tama yung sinabi natin, no? Because sabi dito, if you know you carry CPE, you have to tell the doctor when you make an appointment and you get to the surgery or to the hospital. Or if you're in a hospital, you just have to let the staff know that you have this. And it shouldn't get in the way of your normal home life. Ayan, di ba? So, upon discharge, CPE doesn't spread as quickly outside of the hospital. And it is also less likely to harm people well enough to be at home. So, ito yung sinasabi ko na if you're a healthy individual, if you're a normal healthy individual, you shouldn't be worried or concerned about this kasi hindi ka naman may infect as a may-infect as a healthy person. Not that's not the word infect, but you could be a carrier, but of course, if you're a normal healthy individual, it will not be a risk for you getting an infection. Kasi ifa-fight off siya ng immune system mo. So, but sabi ni Gail kanina, it is, anong sinabi mo yung term na sinabi mo? It is an isolation
discharge. Isolation discharge. Yeah.
Yeah. So, sabi niya doon na it's just that you have to be careful. Kasi syempre, like coming from the hospital, in the hospital, we know na people who are getting admitted have the higher risk of being exposed to a lot of microorganisms. Kasi nasa hospital, parang kung sa hospital pa, para siyang petri dish, di ba? Parang petri dish sa lab, na nandun nag-grow ng mga microorganisms, mga bacteria, whatsoever. So sa hospital natin, parang ganun siya. So when we go home,
and you know guys, yung mga patient naman natin, they're in the hospital because most likely they are sick.
They're sick.
Most likely they are sick, ganun, or they needed surgery. So if they are sick, they are at high risk because their immune system, is compromised. So when it's compromised, tapos nag-introduce ka pa nitong mga superbugs na to, then most likely they'll be symptomatic and they'll be like, they'll be not safe. They won't be safe, and it will cause them harm. So
exactly. So basically, guys, for people that are being discharged with this kind of superbug or with a history of this, you should always just give them a health teaching na yun na nga, they have to wash their hands often, they have to be careful when especially if they're vulnerable, if they're part of the vulnerable population, they have to be careful in having visitors or friends. But basically, guys, bottom line is if they are at home, if they're well enough to be at home, then there is no need to worry because they are already well, di ba? So as long as they follow the proper hygiene practices, proper hand hygiene, I think it will be less of a concern, di ba?
Oo. Guys,
Ayan.
emphasize ko lang pala guys ha. Sinabi ni Golda that you need to know the health teachings. So kaya natin to pinag-aaralan is because pag tinanong kayo sakali nung preceptor nyo or nung senior nyo na ay ano turuan mo nga si ano nun kasi anin siya discharge na siya pero positive pala siya ng MRSA. So you at least know what to tell your patient. And also, say for example, may student nurse, sabi niya pa, ma'am talaga, kasi Pilipinas
Ma'am,
talaga eh. Parang kunwari sabi niya, Golda, what is MRSA? My patient has MRSA. Should I be scared that I will get it? Parang ganon. Will I be sick with it? Parang ganon. So at least you know what to teach the students because most HSC hospitals are like or most hospitals even here are teaching hospitals. So you'd be working with students, medical
yes, exactly.
students, nursing students, lahat ng students, pwede, ganon.
Oo. So,
Ayan.
most of the HSC hospitals here, not just, actually, you know what, Gail, nung nandun ako sa nursing home, we had students from Trinity College. So, it's not just in the hospital na magkakaroon kayo ng estudyante minsan. Minsan sa mga nursing home din. Depende sa nursing home nyo. So, basically, alam niyo nung college tayo, nung nag-ano tayo, di ba meron tayo nung fourth year ba tayo, may tinatawag na practicing clinical instructor as part of our nursing, tawag dito?
Program.
Nursing ethic, nursing jurisprudence natin. Basta nung college tayo. So, as nurses, we are also being trained to train the future nurses. Tama ba? So, para kasi at least, ina-assess din kayo kung gaano kayo kagaling mag-pass on ng information, gaano kayo kagaling mag-explain ng isang procedure para maintindihan din siya ng colleagues nyo or soon-to-be colleagues nyo. So, paano ba natin dinadiagnose itong mga superbugs na to, Miss Gail? Ano bang kailangan natin gawin? Kailangan bang kumuha ng dugo or sample ng ihi? Ano bang dapat natin gawin? So, the most common way to diagnose these superbugs, your CPE, your VRE, your MRSA, is through getting swabs. So, ito na ngayon, anong klaseng swab? So, your MRSA, you need to get a swab sample from the nostrils, tama da? Diba? From the nasal swab and from the groin. Same ba siya sa pediatric, Gail? Hindi ako sure ha. Pero sa adults, MRSA swabs are taken from the nose and the groin. And that is the most common screening MRSA swab that we are using
Actually, may
here.
tanong dito si AJ. Sabi niya pa, nasopharyngeal swab lang po ba gagawin dyan for MRSA screening or lahat po ba? So, depende yun siya. Katulad kay Golda, sa adult is nose lang and groin.
Groin, oo. Nasal and groin. Yun yung screening. So, for all admissions, nasal and groin swabs are mandatory for those being admitted in the hospital for MRSA. And then VRE and CRE are rectal swabs. Sorry guys, VRE and CPE, because CPE and CRE are kind of the same. Pero for discussion's sake, we will just discuss CPE. Pero pareho lang sila ng CRE. So CPE and your VRE,
it's still the resistant or carbapenem resistant enterococcus. Bacteria.
Ang hirap kasi nito mga scientific name na to, ano?
Pero sasagutin ko yung kay AJ. AJ, kahit positive ka, kasi di ba nag-swab ka dyan, pagpunta mo dito, isa-swab ka pa rin, mostly ng occupational health. Pag nag-positive ka, bibigyan ka lang ng treatment. I believe may parang Naceptin cream ata sa nose, tapos hibiscrub ka for your body. So for babies, newborns, eto newborns, 5. Nose, throat, axilla, groin, umbilicus.
Ang dami naman, girl.
Sa child, yes, exactly, AJ. For nurses, for nurses na nagpupunta dito. Etong sinasabi ko na may umbilicus is sa newborn
Pediatric yan
or
ha.
sa patients
I-emphasize natin kasi baka
transferred.
mamaya, ano nila yan, di ba?
Oo,
Ay,
hindi isaswab yung
ano lang to,
umbilicus nyo guys ha.
kaunting kaalaman from Miss Gail. So sa pediatric, kasi si Miss Gail ang ang expert sa pediatric. Sa adult,
Expert
guys,
talaga.
which is adult din naman ang example nyo kung sa RCSI exam. So it is your nasal and groin swabs for the MRSA. VRE and CPE, your rectal swabs. Sige, Gail. Continue.
Ayan. Yes, AJ. So, AJ, depende sa institution nyo. Kasi sa institution namin, nung iniswab kami, nung dumating, nose, throat, axilla, groin. So, kung saan ka nag-positive, doon ka iti-treat. Okay? Tapos, yung sa babies, dadagdagan mo lang, or sa newborns, dadagdagan mo lang ng umbilicus or yung sa mga transferred from different hospitals. So, yun na nga yung sinasabi ni Golda pang adult. Ayan. So, Miss Gold, what are the symptoms of CPE infection?
Ayan. So, just like any other infection, alam naman natin na kapag merong infection or disequilibrium in our body, talagang lumalabas
disequilibrium tayo dyan, friend.
Infection na lang. Fever na lang.
Fever na lang daw.
Yes.
Ang hirap spell disequilibrium, guys. Wag na lang, fever.
Okay, so basically, kapag may something wrong sa katawan nyo, ito pa rin ang mga common symptoms. Like high temperature, aches and pains, chills, tiredness, weakness, confusion. Kaya, anong solusyon? Ilabas ang pau de arco.
Grabe siya.
Oy guys, this is not a paid wala kaming
Oy ba, pau de arco baka naman. Tiger balm baka naman. Ano pa? Ay, meron ako. Ang tawag dito. Salon pass baka naman. Alam mo na, salon pass.
Malay mo, di ba?
Malay mo. Ayan.
Malay mo, mapansin tayo dyan ng mga Philippine companies, di ba?
Dapat,
Paul Jake from Cebu.
Mag-dance-dance tayo dito. Tapos, aray, sa likod ko.
Diba?
Use salon pass. Oh, di ba?
Ano yung kay Paul Jake, di ba casino rubbing alcohol, tsaka efficacent oil.
Baka may mga friends kayo dyan, tumatanggap po kami ng sponsorship.
Anyway, so, syempre, di ba? So, na-mention natin yun. So, anything na nagkakos ng infection, yun yung mga signs and symptoms, right? So, sino ba yung mga may higher risk of this CPE? So, of course, basically, lahat ng nasa ospital may higher risk of getting CPE or other superbugs. But, most especially those who are having major surgery. Kasi daw kapag major surgery, it is an invasive procedure. So, maraming mga risks for getting the major surgery. Having a medical device inserted into your body, such as a catheter or IV line, anything, those people getting a central line, mortocastic line insertion, even indwelling urinary catheter insertion, even the simplest as putting a mere IV line, it will put your patient at risk for developing this superbugs. Those who are undergoing cancer treatment because their immune systems are low, and those who are being treated in an intensive care unit or a transplant ward. Kasi syempre, anything that will try to mess up your immune system, of course, magre-reklamo yung katawan natin. Kasi nga, kaya magre-react siya. So magkakaroon ngayon ng cause for infection. Okay. So, kanina pa natin siya, treatment of your CPE infection. If you have a CPE infection, you can be treated with a specific type of antibiotic, as common antibiotics usually will not work. So, dito ngayon papasok yung proper use of antibiotics. Diba? So, kapag po tayo gumagamit ng antibiotics, hindi po katulad sa Pilipinas na basta-basta lang, naipapainumin natin ng lola natin amoxicillin ng 7 days, 3 times a day. Hindi po ganon. So, kaya...
ang talino kasi ng mga Pilipino. In fairness talaga. Ayan.
Diba?
Actually, hindi. Natatawa ko kasi I know this is reality kasi. Kaya, di ba, parang pag nagtanong, uy, inuubo ako, ano iinumin kong antibiotic? Ay, friend, Pa-check up ka muna kay
Oo.
doktor.
Oo. So, 'di ba, ayan ang ano natin. So, we will now go back. Sige, stop ko muna. Wala ka bang mga comments dyan, Gail? You wanna shout out people? So, I know we are already
Wala, si
1
AJ
hour.
lang yung nagko-comment. We have 10 million, 10 million, 10,000
Hello, guys. So, we
viewers
have,
ngayon. Shout out sa inyo. Guys, mag-comment
ayan.
down below kayo kung nasan kayo para magkaalamanan na, para alam namin kung mag-a-Arabic kami. Wow,
Ay,
mag-a-Arabic.
Chot. Giyak
Or
mga yun, Gail.
magtatagalog, magbibisaya ba kami? Or baka nasa Germany kayo, mag-German kami.
Chos!
Wow, German.
Bonjour, Salaman. Oh, 'di ba? Sino nasa
Vici,
ano?
Vici.
Nasa France.
Oh, di ba? May pa
Oh,
French si Miss
nasa
Golda.
French.
Ayan guys,
Ayan.
mag-comment
So,
down. Etong 10 to makukurot ko. Hindi nagsasabi kung nasaan galing. Biglang, ayan. Tapos again guys, ano pala, reminder pala, eto ha, I've known people, i-share ko lang kasi habang nag-aantay na. I've known people who actually, who weren't successful to actually pass all of the stations. So, out of 14, kunwari say, na-fail sila ng 2 or 3, yung mga ganyan. And then they have to repeat it. Remember, katulad ng sinasabi namin ni Golda, it won't define your, it won't define you, it
as a
won't
nurse.
define your, as a nurse, and
Yes.
your capabilities. Kasi minsan, we're placed in a position na, alam mo yun, na parang i-assess ka, and sometimes we are not comfortable about it. I'm not comfortable about it. Alam niyo yun, yung parang ayoko yung ina-assess ako, like parang 'pag may nakatingin sa'kin parang mas magkakamali ako. So, these are circumstances na hindi naman natin maiiwasan because it is an exam that you need to be assessed. Pero alam mo yun, they weren't successful but eto yun, sometimes yung mga circumstances na ganito, it will actually just teach us. Sometimes it teaches us to be more patient, to be more diligent in studying, to be more humble. Kasi
Sometimes
minsan,
to be more confident as well. Kasi minsan, alam natin yung kakayahan natin eh. Kaya lang nahihinder tayo kapag pinapangunahan na tayo ng kaba. At saka kapag pinapangunahan na tayo ng negativity. So,
negativity should not foster.
yeah. So, kung naniniwala kayo na kaya niyong gawin, paniwalaan niyo na all the way. Kasi, your thoughts become your actions, diba? So, when you attract the positive, you become the positive, diba? So,
Oo, at saka kung
ganun
ano
yun.
yung, oo nga, yung sinasabi nga ni Golda na parang yun na nga, i-attract positive. At saka sometimes you just have to tell yourself na parang you have to be your own hero, you have to be your own coach, your cheerleader. Kasi minsan, you don't have everyone to be cheering you. Alam niyo yun, yung parang kailangan ako na lang, sige, kaya ko to, kaya mo yan, Gail. Parang alam mo yun sa sarili mo. Pwede mo sabihin, Debbie, ayan, Debbie, kaya ko yan. Hi, Debbie, ayan, nasa comment si Debbie. Hi, Debbie. Ayan,
Actually, ngayon ko lang
Gracia
inopen
Belt.
yung
O, diba?
mo.
Hello,
Ngayon
Gracia
ko lang
Belt.
inopen. Ngayon ko lang inopen.
Ngayon mo lang ba
Ayan.
inopen? Ayan. Sabihin mo sa sarili mo, Gracia, kaya mo to. Alam ko yan. Superbugs, na-discuss namin yan. Nag-group study kami. Mga ganon. Ayan. Di ba,
Sige,
Maeve the Explorer?
Before we, for 1 hour into that, I think, medyo natakal naman natin, pero I just want to talk about a little bit. Actually, hindi yun yung lahat eh. When we discuss Superbugs, so in the RCSI website, this is just a little part of what you would see in the infection control part of it or station of it. So, na-mention natin kanina yung 5 moments of hand hygiene. Na-mention natin yung mga proper personal protective equipment. Na-mention din natin yung how to diagnose your superbugs and how to prevent them. And na-mention natin si antibiotic resistance. So, medyo yung mga pinag-mention namin kanina, puro pahapyaw lang yun, guys. But if you want to do a deep reading, a deep dive of all these topics that we have talked about, just go into the RCSI website. And don't forget to follow Miss Gail on YouTube. Subscribe to her channel. Click the notification bell. Diba? Ako na nag-plug for you.
Diba? Nag-plug si Miss Golda. Ayan.
Yan. So, pero ito lang, i-share ko lang muna. What is antibiotic resistance? Ito pala, sorry. Kasi nakita ko siya. before tayong magpatuloy sa ating chikahan, because I think we've actually discussed most of it. So, ayan.
Ayan.
So, this is coming from cdc.gov. So, this is the official website of the Center for Disease Control, charot, CDC. So, what is
Grabe
antibiotic?
siya.
Antibiotic resistance happens when germs like bacteria and fungi develop the ability to defeat the drugs designed to kill them. That means the germs are not killed and continue to grow. So infections caused by resistant germs are difficult and sometimes impossible to treat. So kaya ibig naman sabihin, we have to be careful in using the antibiotic. So bakit gusto ko ito ipakita sa inyo, guys? Kasi gusto ko i-emphasize na when you teach your patients about the use of antibiotics, you have to really, aside from giving them the 10 rights of medication administration, you really have to emphasize the importance of properly taking the antibiotics. So dapat yung proper duration, proper frequency, and the proper antibiotic that has to be taken. And of course, it has to be properly prescribed by their doctor. So not by the nurses, but by the doctor, di ba? So wag po tayong basta-bastang mag-take ng antibiotic na hindi naman kailangan at hindi prescribed ng doktor dahil it will lead to more problems such as your antibiotic resistance. So, kaya gusto ko siyang i-emphasize. Okay ba? What else? And guys, pala, under your infection control, it's also under the yung waste control management ng, or I think that's another topic, Gail, no? Parang nag-discuss na kayo niyan. But it's also, so all these things.
Nag-discuss kami ng... Sige.
Basta parang all these things, itong mga hand hygiene, Superbugs and everything, it's under the infection control station. Ayan. Sige, I'll give the floor to Miss
Actually,
Gail.
guys, and then actually, guys, if you check other RGN prep na na-discuss, actually kasi papos-pos may mga times, busy kasi kami ng mga past few weeks, kaya marami kami inasikaso, with regards to our, professional growth. Kaya medyo hindi tayo nakapag-live stream, ayan. So, ano ba itong sinasabi ko? Sa mga previous RGN preparation, marami ng mga discussion. Actually, guys, pagtiisan nyo na lang po. Apakahaba po talaga, pero napakadaming natutunan talaga. Kasi, alam mo kasi yung nagde-discuss kayo, tapos may magtatanong, biglang marirealize mo, ay, oo nga pala, eto yung sagot dito sa tanong mo. Kasi sometimes, may mga tanong from previous live stream na sinasagot namin sa next live stream. Kasi nga, syempre, we didn't get the chance. Sometimes, may nagtatanong, ma'am, ano pala yung ganito? Tapos, ay, wait lang, hindi ko alam yun. Sige, hahanapin ko or magko-comment ako dyan sa live stream niya. Minsan, nasa sunod na live stream siya. So, kailangan, if you have time, alam nyo guys, yung naliligo kayo or nagluluto kayo, i-on nyo lang. Na parang naririnig nila yung boses namin.
So, I think, Gail, we have discussed like the most important points when it comes to the Superbugs. Baka may mga questions pa sila na gusto nila.
Oo, baka may questions. Actually, nagchichikahan sila sa sa baba. Actually, guys, binabasa ko yung mga chikahan nyo.
Babati ako sa mga...
Ayan, pala, oo, si Maeve the Explorer from Iloilo. Then si Debbie, halin sa Iloilo ba? Halin sa Lapas?
Sa Ilonggahan. Ayan.
Ay, yung mga guwapo.
Hello to Marvin Messina, Maeve the Explorer, Mads Manikat, Donna Faye Bernabe, AJJJ, ito yung pangalan niya?
Oo.
John Tolentino, and who is this? Debbie, Gracia, ayan ang ating mga masugid na taga-subaybay.
Oo, nanonood. Kanina pa sila nanonood. Ayan, shoutout sa inyo. Tapos, alam mo, mga Ilonggo sila, Ilongga. So, naka-move on na ta? Na-move on na ta sa atin nga, Miss Universe? Or ano man?
Sa inyong kandidata?
Sa US. Nag-isip ako na ano sasabihin ko, hindi pala pa. May natasang 12, galantaw subong. Davao ka, Gracia. So, Bisaya. Bisaya. Bisaya si Miss, ito pala si Golda. Bisaya si Golda,
Oo.
Bisaya din ako. Ayan.
Basta
Pero
yung
for
mga
the
Bisaya
sake
din
of,
ha.
for the sake, nagtagalog mi diri. Uy, nagkalisod talaga kami magtagalog. Pero, ayan talaga, naningkamot talaga kami magtagalog.
So sabi ni AJ, meron po bang reviewer na pwede namin mahingi while waiting for our flight? So, while waiting for your flight, go onto the RCSI website, download all those readables, and read through them because nothing can beat the RCSI website. I tell you guys, everything is there. So, yung mga nangihingi ng, actually guys, wala talagang reviewer. But all the links that we are getting, all these information, all these fact sheets whatsoever, galing po lahat sa RCSI website. Well, kami ay nagbe-base lang din po doon. So, we're just trying to discuss it to you based on our experience and our own experience when we were taking the exam before. But I think that's the best source of information. And then of course, you still have Google, but make sure that it's coming from a credible source. So make sure that dun siya sa mga yung official website. So like if you're going to research on Google ganyan, punta kayo dun sa mga hse.com or dun sa mga hse.ie. Ano pa ba? Yung mga official websites lang yung puntahan mo.
HSC, RCSI, yun yung mga website na reliable talaga. Or minsan merong lumalabas kasi na NHS, pero I'd say just go sa sa
Pwede din naman yung sa NHS. That's the UK pero if you will see a HSE one, much better, 'di ba? Para at least kasi yun yung focus nila kasi HSE is the Health Service Executive and that's the official parang health governing body of Ireland.
Kung sa atin, Department of Health, dito ganyan. Maeve the Explorer, ayan, i-add kita sa group chat ha. Pero, may schedule ka na ba, Maeve? Ayan. Para hindi ka masyado mawindang doon sa mga, sa mga pinag-uusapan, mga dinidiscuss lang doon. Ayan. So, si AJ, hindi pa nakapag-move on sa ating Miss Universe.
Sino ba ang tawag dito? Sino ba ang prepare? Lahat sila preparing for the exam pa, di ba? You're all preparing
for the exam. Actually, wait lang, may nabasa ako kanina, nasa Limerick siya. Ayan, si Donna Faye. Hi, Donna, nasa Limerick. Sabi niya pa, from Ireland po, ma'am, nasa Limerick. Wow. Andito ka na. Baka to siya, baka dependent. Dependent ka ba, Donna? Ayan, comment down below. Sir John Tolentino, hello po. Ayan, sa mga nanonood, ayan. Thank you for joining us today. Actually, ang tawag na ito, we have upcoming live streams pa. Pero hindi pa ako makapagbigay ng date kasi syempre yung availability ng mga tao and like now that the lockdown
has
eases, everyone wants to be out of their houses. Gusto namin lumabas kahit na alam mo yun, you just want to go for a walk kahit sa park. Para lang naman, alam mo yun, para maiba lang yung environment. Para hindi lang laging ospital at bahay.
True. Ayan. Pero kasi ako, going back to work after my annual leave this week, work na naman ako this Friday. And then for June, I actually have a packed schedule.
Ay, hindi. Yung pinag-uusapan namin na na mag-meet tayo. Oo. Meet and hike. Hindi natin sila meet and hike. Ayan.
Yeah, meet and hike.
Guys, tama nga pala sa mga nanonood or sa mga manunood nito, sino yung gusto mag-join? Meron tayong cliff walk sa 30. Kung sino ang gusto mag-join, PM me. Mag-PM kayo, okay?
Uy, sabi sa news, meron daw storm.
Naku, hindi. Mawawala ang storm. Sabi nga, kahapon mag-i-storm ngayon. Wala namang storm. Pero medyo cloudy siya.
Pero medyo cloudy siya. Outside. Ayan, sunny dito.
Ayan, so sabi pala ni Maeve, sa July 3 to 4 ang kanyang exam. Tapos si Donna sa July 24 and 25. Ayan, medyo malayo-layo pa pero maganda na nag-aaral na kayo ngayon. That's good. Goods yan.
Dapat talaga mag-aral na kayo. Because nung time ko, 2015 na interview, tapos waiting for decision letter. As early as 2015, November, December, nag-start na ako mag-aral and my exam was June
Sana
2016.
all. Sana
Oo.
all po talaga.
Oo.
Nakapag-review ng gano'n. Kasi ako, if I was given a chance, as in talaga, sana talaga sinabi ko sa utak ko, sana talaga nag-review ako. Kasi, nothing beats,
Kasi
a
at that
proper
time,
review.
wala naman
Kasi, alam
kasing,
mo yun,
walang
parang you will
nag-review
just,
sa amin. I mean, nag-review yung friends namin, pero walang ganito, walang Miss Gail, walang Miss Golda na may YouTube channel. So, at that time, everything that you had to rely on was on the website. So, tapos, nag-gather lang ako ng mga review, yung mga nursing books from before, si Udan, and si Brunner, and si Dart, yung mga college. So, I just brushed up on like a few things, medical, surgical, nursing-wise, ganyan. So, nagbasa-basa ako. And then, yung mga fundamentals of nursing, binasa ko yung mga procedures, ganyan. Because, ang iisip ko noon is, nursing is universal. So, kahit iba yung standard dito, if I study the ideal standard of nursing, there is no way for me to be wrong. Kasi, as long as I can explain that this is what's in the book, ganyan, this is what I've learned in my nursing studies. So, talagang madedefend niyo yung sarili niyo kapag tinanong kayo ng assessor, di ba? So, yun lang yung nasa, although we have to accept the exam back then was so different from the exams that we have most recently, especially this time. I think
because
the level
pandemic.
of preparation, yeah, but the level of preparation, if yun yung sinasabi ni Gail, guys, na if you can afford to have the time to really study and review and prepare, make the most out of it kasi hindi kayo magsisisi. Especially like if, kunyari, nasa Pilipinas pa na kayo and then nabasa niyo na most of the links, tapos pagdating niyo dito, magkakaroon ka ng isang katulad ni Miss Gail na pwede kayong i-study or like all the other individuals that are like giving group study sessions as well. Additional na lang yon kasi nabasa nyo na, di ba? And you have the confidence already na to face whatever questions that will be there. Kasi nabasa nyo siya, di ba?
And tandaan nyo, guys, yung exam will mostly, the result of the exam will depend on you. Kasi kayo naman yung haharap. Kahit nasabihin pa namin ang sagot ngayon, paano kung wala kayong maalala? So, yun na nga, just study and read about it. Kasi pag alam nyo yung feeling na alam nyo sa sarili nyo, kahit batuhin kayo ng kahit na ano, balik-balik ta rin man yung tanong, alam nyo yung maisasagot nyo. And sagutin ko lang pala tanong ni Debbie. Miss Gail and Miss Golda, I recently did a HSC LAN online program about AMREX basic IPC. Ano yung IPC? Infection control ba to? Kino-consider ba ng employers? Yes. When it's under HSC LAN, pwede siya. So, kung kaya nyo nang sagutan yung infection control doon, actually, yun yung nire-require ng mga agencies ngayon. Na before kayo makapunta rito, nasagutan nyo na yung mga HSC LAN. Ayan.
So, guys, ito pala sabi ni Donna Faye, she just doesn't have, so, very good, Don, na nagre-review ka. Meron lang daw siyang na she doesn't know what to expect sa RCSI. So, guys, if you go to the FNI Facebook page natin, sa Philippine Nurses Ireland Facebook page natin, in the files section, merong files doon. Click that, and then look for the overview of the 14 stations. Download nyo yun. Tapos, basahin nyo siya. Yun yung format ng exam. Kasi nandun yung key points for assessor. So, ano siya doon? Para siyang moving exam na room per room, merong assessor. As in, literally may bell. Bibigyan ka ng 1 to 2 minutes outside the room. Kukunin ka ng assessor. Papasok mo sa loob. You will be explained. Nasa labas pa lang ng room, nandun na yung scenario na ano yung ipaperform mo sa loob. So that's the format of the exam. So the OSCE part of the RCSI or the 14 stations is like a moving exam na parang return demonstration nung college tayo. But you will be given time. And yun. So you will just be given 10 minutes to perform each station. So that is 7 stations in the morning and 7 stations in the afternoon. Yun yung sa OSCE.
Yun yung sinasabi ni Golda na mada-download yun. Nasa website din yun. Pero pag nagpunta kayo din sa FNI, diretso na yun, nandun na agad. Tapos pag binasa nyo kasi siya and you familiarize yourself with the situation, with the scenarios, alam nyo na sa sarili nyo na, eto pala ito, eto ganito ang hahanapin niya. And nakalagay doon yung i-assess sa inyo, kung i-assess ba yung how do you kunwari standard precaution, yun nandun yung nakalagay. So ibig sabihin, yun yung focus. So make sure, say for example lang, may station, tapos ang nakalagay doon is discharge. So alam niyo na sa discharge, 'di ba? Health education, health teaching, arranging your discharge planning with your
Arranging
multidisciplinary
the
team.
appointments with whoever
So alam
after
niyo na yung
discharge.
ganon. So at least, hindi na kayo, kunwari, ang topic pala, kahit nag-discuss siya doon ng infection, ganyan-ganyan, alam mo na ang topic is, no, I won't focus on the infection, I will focus on, yes, may infection yung pasyente, but the focus now is discharge. So
Is
I
the
will discuss the
discharge,
discharge. Oo.
Yeah.
Sabi
May
ni
tanong
Maeve,
pala si
ayan.
Maeve, hindi po ba
Sige,
nagbabago-bago yung format ng practical exam? So, hindi siya so the format is the same because it's 14 stations. Ang nagbabago-bago lang are the topics and the questions and some of the scenarios. But the format of having 14 stations is the same.
And
So
having the
far.
format of having scenarios and then kung ano yung i-assess, same pa rin kahit noon, kahit ngayon. But then like yun na nga, syempre at some stage siguro sabihin natin, ngayon lumabas yung ganitong topic, discharge. Tapos next, hindi na discharge.
Iba-iba lang siya. Oo. Minsan, change na yung scenario. Kasi para naman hindi siya, you know guys, the downside of having these reviews, alam mo yung masyadong memorized. So, ito yung sinabi talaga to ng isa na taga-RCS. I'm not gonna mention her name because I don't want to, this is a disclaimer this is just based on our experience. So, the proctor or the facilitator of the RCSI, you will know her name when you meet her. Itago natin siya sa initials na MN. Ayan. So, actually, nandun yun sa website. One of the downsides why applicants are not successful in taking the exam is because it's overly memorized. So, wag tayong kabisote, guys. Kaya yung format ng discussions and group studies namin ni Gail is through definition, through like situation basis, because we don't want you guys na i-memorize. Ayaw namin na scripted. Kasi kapag naiba na yung script, hindi niyo na alam kung ano yung sagot. Whereas if you understood it from the root, from the definition, from the bottom line, whatever questions that will be thrown at you, you'll be able to answer it. So, yun yung
kasi merong iba na maggagawa ng script. Kasi nga, sometimes, it works with them, but it won't work I'd say, in every station. Syempre, sometimes, say, for example, an upset colleague, parang ganon. So, hindi mo kasi alam yung sasabihin, di ba? So, but then, if you make a script,
the only script that I would like to suggest is when you're introducing yourself and when you're identifying your patient. So in all the stations, pwede niyo sabihin, good morning, my name is Nurse Golda. I'll be looking after you today. Can I have your name and date of birth, please? How are you feeling today? I think that's yan na lang yung pinaka-importanting script na gusto kong i-advise sa lahat ng nag-exam. And while you're doing that, you can hand hygiene on the hand gel available in the room. So, but the rest, after that scripted introduction of yourself to the patient or to the assessor, kayo nang bahala doon. Because you have to go with the flow. You have to go kung ano yung tinatanong sa inyo. Diba? You have to do what is asked.
Oo. Actually, may live stream ako, guys. If you want to check, I have a live stream on how to pass the RCSI exam, actually. Nagbigay ako doon ng mga tips on how to actually pass O, di ba? May papanoorin na naman kayo pagkatapos nito. Kayo talaga.
Sabi talaga nila,
Ayan.
ayoko na. Nagsasawa na ako sa mga
Sabi,
mukha nila.
actually, feeling ko nagsasawa na sila. Parang, shucks, sila na
Kaya nga.
naman. Si
Oo
Ma'am Gila
nga.
naman kung ano na naman sinasabi. Ayan.
Totoo.
But
But
guys,
guys,
thank you for
anyways,
joining us talaga today. Ayan. We
yes, because
really
we are
appreciate your
already,
presence kasi hindi naman, kumbaga pa, hindi naman kami magla-livestream kung walang manunood, guys. Kung kami lang ni Golda, ako magchichikahan na lang kami. Ayan. But then because you're watching and you're subscribing to the channel and you're requesting her to come back, ayan, of course, Miss Golda.
grabe
Ayan.
naman.
Ayan,
Ganun, guys. So,
magpalakpakan po ang lahat.
alam niyo guys, ito ha, I will make this time kasi we are on the 1 hour and 25-minute hour na. So, gawin na natin 1 hour and 30 minutes. So, we have 5 minutes more. So, guys, para sa mga nandito na followers and subscribers ni Miss Gail, I highly encourage you guys, lalo na yung mga RGN na, tulungan niyo naman kami. If you have friends coming over from the Philippines or from Middle East or from wherever, from Singapore, pwede niyo silang i-review naman ng kahit konti, na kahit konting slight-slight lang.
Biri-biri light lang
I
po.
highly
Oo.
encourage those who have made it here, who are already RGNs, to just share a little bit of information to our new colleagues, to our colleagues to be that will be coming here.
Because Golda, kung sino ba, who is the best resource of RCSI or of the adaptation? Siyempre,
Yes,
kung
the
sino
best
yung
person-
mga
kung
nag-RCSI.
sino yung nag-take ng exam. So, because you will never understand the exam unless you've taken it. So, and it's not just myself and Gail and a few other people. Sobrang dami na po nang nag-exam. So, if you think, guys, na, ay, hindi naman ako marunong mag-review, mag-ganyan, you don't necessarily have to have a YouTube channel or a Zoom account or whatsoever. Balik tayo dun sa group study na, alam mo yun, magkakaibigan na, okay, tulong-tulungan tayo. So, because we all started from there. I started from there. When I came here, walang FNI, walang YouTube channel, walang whatsoever. It was just the kindness and generosity of my friends who are here that have already made it in the exam that helped me pass. And because I studied and I did my best, yun yung pwede kong i-impart. So, security blanket na yung review, guys. Because you yourselves, you can do it.
Oh, di ba? May paganon si Miss Golda. You yourself, you can do it. Ayan. Shout out,
Exactly.
John Clevan Garcia. Oo, sobrang late mo na dyan. Pa-end na po kami dyan, charot. You can actually rewatch this one later pag na-upload na siya. Ayan, thanks for joining today, guys. And thank you so much. Ayan, Havok, Kova. Ayan, thanks for joining. Ang
So,
tawag
John
nito,
Garcia, Donna Favor Nubeme, Dexter, who else?
yeah.
Gracia.
Guys, sabi ni Donna, yehey, Ma'am Gail, looking forward po sa mga next tips. Ayan, pero meron na akong tips, Donna. Yun yung 10 tips if you watch it. Meron ng tips doon. But for more tips on our upcoming live streams, itatakil natin yan. Ayan. Again, thanks for joining today. And alam mo yon, I think it's just out of Golda's kindness na pinapatulan niya to. Pinapatulan niya yung pinapagawa ko sa Hindi kasi, alam mo
Okay,
yun.
mag-alala, guys. Makakaganti kayo kay Gail, ipapahike talaga natin siya. Actually, next time daw, Gail, kailangan mag-workout, tayo, workout video. Doon sila makakaganti. Anong
Hindi,
gusto niyo,
wala.
guys?
Okay lang
Bibigyan
ako.
ko si Gail.
Guys, okay na
Ipapaan
ako.
natin si Gail. Burpees ng 50.
Okay na ako.
And
Guys, tandaan nyo, operada po ako. Ayan. Hindi po dati po akong lalaki. Ngayon po, iba na po. Ayan. Thank you. Ayan. Sabi ni, wait lang, si Bruce Lee. Bruce Lee, andyan ka pala. Makukurot kita. Hindi ka nagko-comment. Ayan. Sabi niya, thank you. See you soon, Miss Gail and Miss Golda. Very helpful. Ayan. You're welcome, Bruce Lee. Sabi ni John Clevan Garcia, TikTok. Oh, skiri. Gusto niyo mag-skiri tayo. Skiri. Ah, alam ko yun. Ayan. Pero guys, thank you so much. Oo. Thanks for joining. Exciting ang hike na yan. Yes, and I will make a vlog about it sa 30. Yun yung hike namin. Maganda
Kailangan
kasi
daw
pag
may
ano,
live
guys.
stream yung hike.
Pwede din, magla-livestream ako. Pwede
Yung
din.
tipong nasal flaring ka na habang nag-hike.
Oo. Cliff walk yun siya, guys. And kasama namin yung mga new people. And maganda siya because now, pwede nang mag-meet yung mga tao. So long as you're
Yes.
vaccinated, social distancing still, if you're wearing your mask, and hike siya. So, open space siya, hindi siya enclosed space. So, pwede siya.
Yeah.
Ayan. So, ayan. Thank you so much for joining today and I'm really happy na na-enjoy nyo to and because I always enjoy this one kahit na, alam mo yun, minsan kahit nagna-nights ako, so okay lang. Ayan. Thank you for joining us today and I hope to see you soon. We hope to see you soon here. Kasi yung iba, remember guys, eto, i-share ko lang. Nins Paler, if you know Nins Paler from my previous live stream, nanonood siya. Nanonood siya. Si Marvin Messina, si Harold. Shout out kay Harold Palomado. Ayan, nanonood sila dati. Gusto pa nga nilang sumayaw si Golda. Pero ngayon na nga, naka na rin naman. Pero ngayon, RGNs na sila. Andito na sila.
Congratulations to our new
Ayan,
RGNs.
palakpakan po.
Ayan. Time to celebrate.
And ayun. And again, guys, thank you so much for joining us tonight, today, and this afternoon. And I hope you make the right choices in life. But if you make the wrong choices, I hope we learn from it. I hope all is well in your end. Bye-bye. God bless. Thanks for joining.
Bye.